So the first one we're recording is just dorsiflexion of the left foot. You can do this both seated and supine.
Okay.
And I would actually recommend that because we're getting different, we did both ourselves too, right? Which is good, and you're getting different configurations. So you're learning to do the dorsiflexion both in knee flexion and hip flexion. Okay. And then lying down is doing it in knee extension and hip extension, right?
Okay.
So just covering some extra bases there. You can do this by either wrapping like an ankle weight around the tip of your foot here, or attach a band to something heavy down here.
Okay.
Right? And then you're just gonna pull up on that puppy. Yep. And you'll do like 5 of those maybe. If it's a band or something heavy, you have to really work on controlling it back down. So that's also a plyo, which is great. And think about the heel. Yes, if the weight is here, you're gonna have to keep the metatarsals on, you know, to work that too. But I want you to think about the Achilles and the heel going down more than like toes going up, because you can be plantar flex and still go up with your toes. Yeah. Right. So it's more about this in here. So run that guy, and then seated, you can do both the knee flexion and the dorsiflexion in both of those positions too. So you'll run knee flexion here as well. Okay. Again, wrap a band around the ankle, pull back. Yep, and just remember not to pull with the hip.
Keep it down.
Yeah, that'll activate hamstring a little more. You'll do, you know, like we did today, we did about 3 sets of 10. And just give yourself a quick little brief ISO at the end of the range. So pull, 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 staying down in the hip. Good, and then just a 2-second pause before you come back out and do it again. Okay. Just to make sure that that hamstring is on and it's stable there at the bottom. Okay. All right. Perfect.
So, and could I do that with the ankle weight, or should it be the band?
That one will have to be the band, just because the weight in this position, all it's going to do is push you into gravity. That weight isn't adding anything to the. Okay. If anything, it'll be working your quad, right? Okay. Because gravity is going to pull you down. Okay. You see what I'm saying? Yeah. Yeah. Okay. And then let's go ahead and just go supine, so you can see how we want to do this in that position too. Okay. So same thing, right? Yeah. Attaching the band down here. Yep. You're just going off the gas and on the gas. Perfect. And then the other one is you're gonna flex the hip, lift the leg. Okay. There you go. So hip flexion, yep. And intentionally bend, yep. 1 and 2, yep. And so this one you might just do body weight. If you, for some reason, can figure out a way at home to like lie on the floor and attach a band, I don't know to what, a table maybe, something, But I think just body weight doing it is gonna be fine. Okay. Because what we found with that guy was that as soon as you were in hip flexion, we'll go this way so you can see. If you're in hip flexion and then you just let the knee go, it would hurt a little bit. But if you close it, like we're controlling that knee flexion, then it didn't. So I think this is less about the strength and more about just the patterning, connecting those neurons of, hey, don't just let it go, bend it. Does that make sense?